Welcome to a presentation on pastoral care. My name is Iain McVicar. I'm the Director of Undergraduate Medical Education at the Nottingham University Hospitals NHS Trust, based really at the Queen's Medical Centre. Previously I was the Clinical Sub-Dean of the medical school for about 6 years, and part of that job, and in fact my present job, is pastoral care. So, what is pastoral care? Actually, lots of people think about it. It relates to the countryside or to people living and working. It's about shepherds and herdsmen and all sorts of things. And actually, a lot of the analogies we use in pastoral care do actually come from that keeping of livestock. Some pastoral care is also to do with things like spiritual care, and then many religious groups, they talk about pastoral care of their members of the particular religious group, such as members of a church or whatever. And also pastoral care is that which what a pastor does of a church or religious organisation. So it's really, if you like, looking after the flock, whether they be literal or metaphorical. Now, one of my hobbies is actually I keep sheep, and so some of the lessons I've learnt with people, I also see being played out with sheep. And otherwise, the other way round is also true, that sometimes what I see in sheep, I can see the parallels in people. Not meaning to be insulting, but sometimes the sheep get it better and more correct than we do. When we look at pastoral care, if you like, we could simply look at them as acute or chronic. Really, what sort of problems are they? And critically, the acute thing might be something that happens all of a sudden, is a one-off, and needs fairly prompt action and intervention. The chronic thing is something that's been happening for years, and it's more of the same. And again, the way we maybe tackle these is going to be different. So, what are the sorts of issues that we come across? Well, first of all, I've put educational, because in medical student world, one of the big things is about education, whether they can actually, they're turning up to work, but also particularly in terms of exams. Many of the students who would attend are devastated because they failed an exam. These are high-performing young people who are not used to failure, and sometimes managing their own expectations is really part of the problem. There are things where we need to sometimes look at, why are they having problems in their education? And it may be, for example, that they're an undiagnosed dyslexic or have some other educational need. But again, that's things that can be explored in more detail at a later date. The other issues can be professional, and this can be attitudinal. Particularly, medical students are subject to things like much more stringent drug taking policies. The average student in the university, sometimes it's almost the done thing that you take cannabis or whatever, but if you're a medical student, then you actually run the very real risk of being kicked out, because that's perceived as being non-acceptable professional behaviour. And so sometimes some of the issues are relating to that sort of professionalism. It can also be to do with attitudes and how people perhaps are very arrogant. And again, medicine has a terrible reputation sometimes amongst the other professions for being arrogant. Relationships, that's what drives the world, they tell me. And indeed, all sorts of relationships are important. And some of the pastoral issues that I've dealt with over the years could be summarised in relationships, either in terms of significant others relationships, but also to do with peers, parents, you name it. People can fall out or fall in love with people, and it can really wreck their progression in the course or even in life in general. And again, having an idea of how that affects people and how you can help them is also useful. Health is also a huge issue, particularly with mental health issues. Obviously, if somebody falls over and breaks their leg and is unable to attend the course, then that brings its own problems. But mental health issues beginning to be a real issue in medical students, exactly in the same way that it would be in the population at large. And having some appreciation of how to deal with these health issues is also important in helping the student. And then finally, I've put finance, because there are students, particularly some of our overseas students, who have significant financial burden to undertake, and they find that in sometimes their whole performance is affected by their worries about whether they can actually continue in the course. We don't accept usually that students will work as part of the medical course, but of course it's accepted that many people have no option but to do this, but it shouldn't impact on their studies, and when it does, then that is a problem. We don't accept that, for example, working in a pub is an acceptable employment, although we're well aware that people do that, but we wouldn't make arrangements or change people's placements to facilitate this. So some of the clues that there's a problem with a student are really looking for change, and sometimes it's whether, when a student's been successful, had no problems whatsoever, and then suddenly there is something that's not right, and it may be that their behaviour is different, that they suddenly become withdrawn, that they have a very different attitude, that sometimes the person that was the life and the soul of the party is now very quiet, very withdrawn, has lost their confidence. Attendance is something that really need to be on the ball with, because this is one of the early signs that things are beginning to disintegrate and the wheels are falling off the wagon. And when students are persistently not attending, we really need to find out why. Now, there may be some very good reasons. It may be that they've got health issues, which we've alluded to earlier, but it may also be that actually they're very depressed, or they're having other issues which they have not been able to discuss with people. So important to pick up on this and act on it. And again, that's one of the emphases of taking attendance registers, so we can actually clock when people come and when they don't come. Body language is also important. The person who looks dejected and fed up and dishevelled probably is, and we need to probably not just avoid it and say, well, it's not for me to judge, but it actually is for you to get involved and try and find out what's happening. If they're normally a scruffy merchant, then actually we probably should have a word about that as well. But again, it's really looking for changes. So the always scruffy student turning up being scruffy, that's normal. But if somebody's normally well turned out and comes looking very unkempt, then we maybe need to work out why. Also, other students will comment, and they are very good barometers of people's performance socially, and if they note that there have been problems, then they will say things, and again, it's worth listening to them in confidence to work out what's going on. And then we have the cause for concern forms, which used to be called, but they're now called, I think, Pastoral Care requests, or whatever the current title is for the form. This is so that anybody involved in medical student teaching can flag up that they have a concern. This could be academic, it can be attitudinal, it can be health, it can be a whole number of ways and means. But this is really exactly as it says, that it's just flagging it up so that the course office and the clinical sub-deans in the medical school can pick up on this and try and investigate things further, or indeed we at the trust can do that as well. And then I think once you have worked out that there is a problem, then it's important to try and talk to the student. Very important to do this not in front of all their colleagues, because they're not likely to admit to having a problem in front of their peers. But if you can arrange to see people quietly and actually work out what's going on. And I've put down management as the 6 L's. First of all, you need to listen, and you need to actually give them the opportunity of talking. Often what the students want to do is to be able to be heard. When people are disappointed with exam performance, they're usually very angry, and sometimes being able to vent their spleen helps them. So listen and hear and understand what they're saying, and then look into what they're saying. Sometimes they're very unhappy about the way an exam has been conducted. They may have a point, but often they don't. But actually look into their comments and into their questioning and see what actually is behind the problem. And then actually you need to learn, I think, about the problem, actually learn about how, for example, certain help can be accessed. The Students' Union run a very good counselling service, and often the students can be directed to that if they need somebody to talk to and somebody to listen and perhaps give them a gentle steer. There are, for example, educational support packages available, so that if students are struggling with a particular type of exam, then this can be accessed and they can get professional help. So learn about the resources available. You also need to learn about how the course works, because that's important in terms of how it all fits together. I've put lighten, which is that actually sometimes students come in under a huge black cloud, and it's to try and just lighten the mood. That isn't to ridicule them or to make light of what they say, but to try and give them the idea that there is actually light at the end of the tunnel, and that actually to try and just see things in perspective and to try and lighten the mood. That doesn't mean to negate what they say. I put logistics, and again, I think that's because understanding how the course works and how the various module works, how assessments work, really very important in working out how to help and guide the students. Sometimes, for example, students want to take time off, and that can be a real issue, but actually understanding the way the course works can be a good way of being able to help them and have some suggestions about how their problem could be partly solved. And then liaise. It is always good policy that when you see somebody with a lot of problems, that you don't just keep that to yourself. Yes, confidentiality occurs, but that means that not that you just keep everything to yourself. I think it's important that that is escalated and discussed with people, and I think really vital that you share, if you like, the load, and also sometimes share the learning and the experience. Sometimes you've maybe not come across that as a problem, but other people have, and it's important to actually share that and talk to people. And so, expectations. What do the students, if you like, expect from you? Well, they do expect confidentiality. Now, I always say to the students, you have to be aware that confidentiality means a lot of things. It certainly means that we do not discuss them with their colleagues and students, but it doesn't necessarily mean that we don't discuss it with anybody. And there are certain things that the sub-deans need to know, although maybe not everybody needs to know. And so certainly the students need to be reassured that what they're saying to you is not going to be blabbed around and everybody and their dog knows about it. They also expect you to know what you're talking about. It's all very well being a teaching fellow or a consultant or a trainee, but actually you need to know about the issues that they're dealing with. And they expect you to have some experience, both in terms of some of the problems that they have, not that you have to have suffered everything they have, but I think that you can actually be in a position where you can see it, and with a bit of hindsight and a bit of experience yourself, you can perhaps give them a steer as to how to go. You do need to be caring, and I think that goes without saying. You can't do this just as a job. If it is, and that's what you want, then you're probably in the wrong job. But you do need to actually care for the guys in front of you, and they need to be able to feel that and feel that you are actually helping them. You're their friend, and you're there to help them. That doesn't mean, however, that you just take everything willy-nilly and that you just think they're wonderful. And I do think you do need to make some sort of judgment. Sometimes students will tell you that everything is wrong and they're the only one that's in correct step. And of course, that's probably rubbish. What you have to do, I think, is to make some value judgments about what they say and whether that's actually, there is something in it, or whether you just need to let them calm down and see the world in a different way perhaps later. And then when you have had a chat to a student with a pastoral care issue, I think it's really important that you don't just leave it at that. I think probably make sure that they're okay. Obviously, it depends on the severity of the problem as to whether you follow them up in a month or two or whether you see them in a day or two. But obviously, you make a judgment to try and follow them up. That goes with caring, the fact that they have some continuity and that they know that actually they have somebody there to give them a hand. So a lot of things to talk about in terms of pastoral care. Can't do it in a few minutes of a podcast, but gives you some ideas and just some principles. It's basic common sense, laced with a bit of care of the people you're involved with. If there are any questions or queries, or if there are any real problems, please do not hesitate to get in touch with me. You can get in touch with me with my email, or if it's really urgent, then please give me a ring. Thanks very much.